Welcome to The Explainer. Today, we are diving straight into a detailed clinical breakdown of a highly specialized medical product, the Vaginalis Hostilis solution. We're basing our entire deep dive strictly on the manufacturer's official data and clinical documentation. So if you've ever been curious about the precise pharmacological engineering that goes into modern gynecological sanitation, well, you're definitely in the right place. We're going to unpack exactly what this is, how it works, and why it actually matters in a clinical setting. All right, here's our quick roadmap for today. We'll start with a broad overview, then look at exactly how the active composition works, break down the clinical effects, run through the usage instructions, and finally wrap things up with limitations and storage rules. Let's get to it. Section 1. Let's get a high-level overview of Vaginalis Hostilis. So what we have is a 100 milliliter medical antiseptic solution. It comes in a specialized single-use disposable device that's built purely for intravaginal sanitary cleaning. The main goal here? Maintaining hygiene balance within the vaginal environment. It's meant for professional medical facilities or, very carefully controlled at-home use. Clinically speaking, think of it as an auxiliary sanitary tool. It preps patients for diagnostic and therapeutic procedures, drops the microbial contamination on the mucosa, and helps fend off secondary infections as part of a much broader medical strategy.
Now, there's a really crucial legal and clinical boundary we need to establish. On one hand, yes, it's a highly effective medical hygiene tool for prep and sanitation. But on the flip side, and this is absolutely key, it is strictly not a systemic drug. It is not designed to treat infectious diseases by itself, and it absolutely doesn't replace prescribed idiotropic therapy. The specific meds a doctor prescribes to actually kill the root cause of an infection. Basically, it's a powerful support tool, not a standalone cure.
Moving right along to Section 2. Exactly how does this active composition actually work? Okay, the real star of the show here is the colloidal silver, sitting at a very precise medical concentration of 20 parts per million, or 20 ppm. At this specific level, the silver delivers a major antiseptic and antimicrobial punch. It actively suppresses the growth of pathogenic and conditionally pathogenic microflora, basically the bacteria that usually hang out peacefully but can cause serious trouble if they overgrow. By keeping them in check, it drastically reduces the microbial load on the mucosa, which drops the risk of inflammation. And the best part? It's entirely localized. There are literally zero systemic effects on the rest of the body. But wait, silver alone isn't the whole story. That localized action is perfectly balanced by something called the Syn-14 vaginal guard matrix. This is a proprietary, patented, functional component from Syn-14 and its whole job is to optimize the silver. It makes the solution way more biocompatible with the delicate mucosa, stabilizes that antiseptic effect so it really lasts, and keeps the whole process incredibly gentle. It gives you all the antimicrobial benefits without throwing off the tissue's natural physiological parameters. And just as a side note, the exact tech behind this matrix? Heavily guarded intellectual property. Let's jump into Section 3, the clinical effects and benefits. So how do these components translate into real clinical payoffs? Well, for effects, we're talking thorough sanitary cleaning, a massive drop in microbial contamination, maintaining that crucial hygienic balance, and vital preventive care against secondary inflammation. All of this makes things much more comfortable for the patient during gynecological care. But the real advantages? Alongside that optimized 20 ppm concentration, the absolute biggest win is the complete lack of aggressive, irritating antiseptics. Thanks to that Syn-14 matrix, the biocompatibility is off the charts, making it a perfect fit for standard clinical preparation protocols. All right, Section 4. Let's cover the practical instructions for use.
The manufacturer lays out 5 really distinct steps here. First up, always bring the solution to room temperature. Nobody wants to shock the tissues, right? Second, you've got to use the sterile device it comes with or a proper medical bulb. Step 3, insert the exact volume recommended by the medical professional while in the position they advise. Step 4 is absolutely critical. Keep it in contact with the mucosa for the precise amount of time the doctor prescribed. And finally, step 5, just let the solution naturally evacuate.
Now, I literally cannot stress this enough. The frequency of this procedure has to be strictly controlled by a doctor. Because this is such a highly effective antiseptic, using it too often or for too long without clinical oversight is a huge no-go. This is a targeted medical tool, absolutely not an everyday cosmetic wash. Overdo it, and you risk disrupting the exact delicate balance you're trying to protect. Which brings us to our final section, Section 5, Limitations and Storage Rules. Like any medical product, there are hard contraindications here. Individual hypersensitivity, obviously a no-go. Pregnant patients,
This is strictly prescription only, no exceptions. It's also contraindicated if a patient has an acute, undiagnosed gynecological condition, meaning if there's a severe issue and the doctor hasn't figured out the cause yet, you don't just use this blindly. And again, it's never meant for regular, unconsulted use.
When it comes to storage, protecting the physical integrity of that colloidal silver and the proprietary matrix is everything. Keep it between +5 and +25 degrees Celsius. Keep it strictly out of direct sunlight because UV light will degrade those active components. And whatever you do, do not freeze it. Freezing completely ruins the colloidal suspension of the silver. Oh, and of course, keep the whole shebang well out of reach of children. To tie it all together, the official clinical documentation sums up its identity perfectly. It states that Vaginalis Hostilis is a professional gynecological solution that combines 20 ppm colloidal silver with the patented C14 technology, optimized for the safe sanitary support of the vaginal environment in medical practice. It really is that synergy between the localized silver and the biocompatible matrix that makes it a true game changer in the medical field. To wrap up this explainer, I want to leave you with something to chew on. We've just seen how meticulously this solution balances serious antimicrobial power with extreme gentleness. Given its targeted, completely non-systemic approach, how might proprietary technologies like the Cy14 matrix reshape the future standard of clinical gynecological preparation? Could we see this kind of targeted matrix tech expand into other areas of specialized mucosal care? It's a pretty fascinating frontier in medical hygiene. Thanks so much for joining me for this deep dive.